Welcome to 5 Points Blues presentation of Back to the Basics. Everything you wanted to know about Cowboys football, but were too afraid to ask. Here are your hosts, Nikki Harrison and Kristi Scales.
Well, hello, welcome. Thank you for joining us today. We have got a great show, and we've got an awesome guest here with us. We've got Dr. Reynolds here. You are the clinical director of neuropsychology at Baylor Scott & White Concussion Program.
Sports Concussion Program at the Star.
Oh, yes, it's a mouthful. Say that 5 times,
Yeah,
huh?
exactly.
So, thank you for joining us, first of all.
Thank you for having me.
Explain to us what exactly is neuropsychology.
So I have a doctorate in clinical psychology. So I did graduate school for clinical psychology, and then I did 3 years of training in neuropsychology, which is the study between brain and behavior relationships.
Okay.
So traditionally, it's paper and pencil-based testing, looking at memory, attention,
She's a little bit
things
too
like
far
that.
off the mic.
But now we have different methods to use for sports concussion. It's a little bit more modern.
Very good.
And so before you came here to Baylor Scott & White at the Star, you were at University of Pittsburgh and their sports concussion program, which is the largest in the world. And you've brought that here to the Star and have participated in past parents' clinics and moms' clinics. And it's always been great to help lead those panel discussions, and that's how we got to know each other. But since it's back to the basics, let's start this very important show, because anybody who has a child or a grandchild participating in any physical activities, whether it's a sports team or individual sports, or if you're a weekend warrior out there, you know, this is a very important show. And we want to start back to the basics. And Dr. Reynolds, what is the official definition of a concussion?
So a concussion happens when your brain shakes inside your skull. You don't have to get hit in the head to get a concussion. So if you have that whiplash motion, your head can shake. And I always say to think of an egg. If you take a raw egg and you shook it, the yolk would bounce back and forth, and that's what happens with your brain. So on the cellular level, once your brain shakes, it affects all of your brain cells. We have 100 billion brain cells, and they're all designed with a cell membrane on the outside that keeps potassium inside and calcium outside. And so when the brain shakes hard enough, all of those brain cells stretch, and there's a chemical exchange. That's the injury. The brain immediately recognizes there's something wrong there and kicks into repair mode, and that's the recovery period, which is different for everyone.
Yeah, and we have some of the slides that are part of your presentation that you do to parents and other professionals here, and we see the one of the egg there. But you talk about, and we'll go to the next slide here. Thank you, Douglas Barraclough, and thank you, Kent Garrison, for helping get us up for this. But the energy crisis during a concussion, and I know that looks very complicated
Yes.
when you see this, but could you please put it in layman's terms for us?
So it's really just that chemical exchange. Once the potassium starts to leak outside of the cell, the calcium rushes into the cell. And that creates that toxic environment in the brain cell that the brain then needs to heal. And the healing process takes a significant amount of energy. And unfortunately, one byproduct of that is that the blood vessels that go to the brain start to constrict, and that slows the blood flow to the brain, which is the energy source. So you really wind up in this state of needing energy, having a lowered supply, and that results in this energy crisis.
I see. And so now if we can move along to the next one, you talk about the repair and the process, you know, how the varying times of that process of recovery. But let's talk about some of the signs of concussion.
Sure. So some of the signs of concussion, if you're a parent and you have a student athlete playing, some are very obvious if someone loses consciousness or they're vomiting on the field or the court, but some of them are more subtle. So the appearing dazed, confused, stunned, sometimes that's not something that a parent can see. Sometimes you have to rely on the players or coaches to identify that. But the disorientation or confusion, if you're watching, you know, let's say a football game and your athlete's running in the wrong direction, that's a pretty surefire sign. But sometimes it's much more subtle than that. So afterwards, asking them, you know, do you remember what happened? Do you remember what happened after the injury? Those are all signs that there's been some kind of brain disturbance.
And I can speak to that. My son was concussed when he was about 7 years old, and his wasn't even from a sports injury. He was just playing at school, and he fell, hit his head, and at the time I had no idea what to look for, but he could not tell me what happened. He could get to a certain point, couldn't tell me exactly what happened, and then afterwards. and just how he hurt, the pain. So that's very, very scary because you can't really even explain to the doctor what happened.
Well, and part of the problem with, identifying concussions, so we try to educate kids on what to look for. But if they are disoriented or confused, they may not even realize. They may not make the decision, take me out, coach, I need to get looked at. And then they come in and mom says, well, why didn't you say something? Because they really maybe didn't know. And so not everyone's going to have all of those signs. Some kids may have none of those signs, but if you start to dig, you can usually find a sign that something happened there.
Yeah, which of the signs did you see in your son, Nikki? You saw the vomiting?
Yes, the very next day he was playing again, and it's probably because he should not have been involved in any activity. Right. We didn't know he was concussed at the time, and he started vomiting. But what really just drew a red flag for me was the fact that he couldn't remember what happened. And I'm like, you were just playing, and you can't tell me what you did, and he couldn't. Bless his heart.
Yeah. Next, we want to look at some more, and some of this is similar to signs, but let's go on to the symptoms of concussion, and that includes things, like sleep, some of the most basic things. So if you could take us through this, Dr. Reynolds, some of the symptoms of concussion.
Yeah, so we always think about the symptoms in kind of these 4 categories. So there's the physical symptoms. Headache is far and away the most common, but it does not occur with every concussion. The dizziness, nausea, sensitivity to light and noise. So we have some migraine type stuff there, some motion sickness. Sleep can look very different. Some kids can't sleep. Some kids can't stop sleeping. Having a hard time sleeping at night is a big one. Cognitively, if they get injured on a Friday and then they feel pretty good through the weekend, Monday rolls around, they go to school, all of a sudden they realize they can't concentrate, they're not able to recall what they learned the previous week. And then the mood stuff. And it's, I have a teenager and I see a lot of teenagers and I always ask, is there a change in mood? And I always get that look like, really? It's a teenager.
It's daily.
Yeah. But that's really looking at more pervasive, change in mood. So significant irritability, a lot of anxiety, emotional outbursts that just aren't typically there. That's what we look for.
Yeah. So as a parent, which of I guess you probably see different ones. It's not really more one thing than another, or I guess it can affect the different people individually, especially the kids.
Exactly. So this is a nice segue into the next one. So,
okay.
About probably 5 to 7 years ago, we started seeing in the clinic in Pittsburgh, kids coming in. We like to see them very soon after injury, so 1 to 3 days. And the first week after injury, it was really hard to tell what was going on necessarily because all of those symptoms were layered on top of each other. It was very ambiguous. Kids just really didn't feel well. And after that first week, that 7-day mark, you could start to pull apart different directions that things were going in. So we did some studies, we ran some statistics, and we identified 6 clinical profiles that we can typically identify after that first week.
Yeah, and let's go ahead and pull that up so that you can take us through those concussion clinical profiles.
I'll have it in just
a
second.
It's coming along the way there. This is some of the hard to pronounce words. So we're going to rely on Dr. Reynolds and her presentation here.
Oh yes.
Okay, so the vestibular profile, that's your motion sickness. So anyone that has a history of motion sickness, that's your vestibular system, that's vertigo, inner ear stuff. The ocular system, those are problems with your eyes not moving together or not moving as smoothly or as quickly as normal.
So that's when you see doctors use the little pen lights to do that. Can that be part of that? Or
so that's more looking at your pupil reaction.
Okay.
So that's more of a neurologic exam.
Okay.
What I do, I can demonstrate this later if you want, but we take a stick or an object and we bring it towards their eyes to see if their eyes are pulling in together. So we want to see if they're converging.
Okay.
And sometimes you'll see some eyes wandering during recovery.
I see.
And so that's a sign, huh? When you see this eyes going in different directions.
If it happens right away, yes, it's a definite sign.
Okay.
Yeah.
Wow. Okay.
So the cognitive profile are the kids that are struggling with the cognitive piece. The post-traumatic migraine are those chronic headaches with nausea, sensitivity to light and noise. Sometimes it's a cervical component. So particularly if it's upper cervical, like C1 or C2, that can look a lot like a vestibular problem. So that just has to be properly assessed so we can understand.
Yeah, and when you say C1 or C2, that's up at the top of the neck.
Yep,
That's right, below top of your neck.
Yep.
Okay.
And then the final one is the anxiety mood profile. And so these profiles, they exist on their own, and they each have their whole list of symptoms, and risk factors and treatments, but it's very rare that you're going to have someone walk in that just falls into one of these profiles. So most kids are going to fall into several of them. And my job is to identify, well, what's the primary profile that they're presenting with? And then I can start to put a treatment plan in place for that. What's their secondary? What's their tertiary? And how do these all interact together? So putting together that treatment plan, you have to take all of that information and figure out exactly where is this coming from, what's not all the way there in the brain.
Yeah, and we'll talk about this more as we go through, because we're going to be talking about risk factors and treatment and the like, and what you as a parent or grandparent or wife or husband, if it's your spouse or someone else in your family, that aunt or uncle that you take in. But we're visiting with Dr. Erin Reynolds, who's the clinical sports neuropsychologist specializing in treating sports-related concussions at Baylor Scott and White, their sports concussion program at the Star in Frisco. And now we're going to talk about risk factors. And so if Dr. Reynolds will take us through some of the risk factors that we see, because there are some things on here that truly shocked me. So
too.
Please take us through.
Yeah. So here's the bad news. There's some things that we can't help in life. We all have risk factors for concussion, some of them more significant than others. The age risk factor, younger children tend to have longer recovery times.
And that's surprising to me, because, usually, isn't it, if you're younger, you bounce back faster? Is it just because things are, we're still developing?
So it's an interesting question. I don't fully know the answer to that, because also as you get older and you get into high school and college, the demands on you are much more significant.
Definitely.
And when you're an adult, it's even more so, right? Because you have work and family. But the research shows us that the younger kids tend to take a little bit longer.
Wow, that's really interesting. Okay.
Females, unfortunately.
And why is that?
So there's a couple of theories about that.
Okay.
There is a theory that says it's about neck strength. So females are built differently than males. We have our necks aren't as big, and so the theory is when we get hit, there's more rotational force. I actually think it's more likely due to hormones. So, when we're in our childbearing years, which now it's younger and younger when females are hitting that point, to the point that we're in menopause, we have a lot of hormonal fluctuation. And the migraine process, which is related to that, females are more prone to migraine, is very similar to concussion. And so migraine's another risk factor. So if you're a female and you have a history of migraine, or your mom gets migraines, or your grandma gets migraines, you're potentially more vulnerable to concussion, and you're potentially going to have a more complex recovery period.
Wow. And there are certainly more girls, ever since Title IX in the 1970s, but more and more girls at even younger ages taking part in so many different sports, whether it's soccer and heading a ball or whatever it is. So you certainly have more girls taking part as well in these physical activities, whether it's
starting young.
Yeah, right. Whether it's an individual sport or a team sport, so that could be part of it too.
People are typically surprised to hear that I treat more females than males. And, I've said for a long time, because the focus on concussion is so focused on football usually, but if you take that aspect out, I see so many female soccer players, so many female volleyball players here in Texas. That's really big. Sure. So with those, risk factors coming into play, I do see more females.
Well, I can't imagine a moody female teenager.
Oh, I can't either.
have no idea. Yeah. Let's go back to the risk factors and keep going down the list here.
Okay, so any learning disability or attention deficit disorder, and I say underlying or undiagnosed because I see a bit of that. So when they come in, I do neurocognitive testing, and I can do more extensive neuropsychological testing as needed. And sometimes the parents will say there's no history, they've never been diagnosed, but you start to see, they're recovering, but some things just don't look right. Wow. And so there may be some undiagnosed things.
And so that's something that can stick with them for the rest of their life.
Absolutely. Well, so here's the bad part. Anything that you have as a risk factor, when you're during your recovery period, we would expect those things to be exacerbated. Okay. So if you have any kind of underlying ADHD or learning disability and it's not treated, you're probably going to really struggle in school during recovery and maybe for some time afterwards.
Wow.
Okay. And I don't want to skip too far ahead here, because, Douglas, we want to stick it on the risk factors and in a moment go back to that. But when you talk about going back to school, and this is something that we've discussed in previous panel interviews for different clinics around town on concussions, and that is, in the old days, it was, keep the kid or whoever suffered a concussion in a dark room and keep them out of school and away from that. And
No
you're
TV.
talking about the kids going back to school. And there's a change, right, in the old thinking and the new thinking.
So when I got into this in 2012, there were still kids that were 3 weeks and more out of school and placed on homebound education. And, we could see just anecdotally that these kids are really struggling. There's a social impact to that. There's an emotional impact to that. And thankfully, our science tends to move slower than what we see clinically, but the science has caught up now. And there's been a number of studies that have come out that have shown that when you get these kids back to their normal activity as quickly as possible, within context and supervision, they actually do much better. Now, of course, that doesn't mean get them back into contact sports until they're ready, but I rarely have kids out of school for more than a day or two, even if they've just been injured.
Wow,
Really? Okay.
interesting. Yeah.
There's
That's
so
a
many,
big change.
Definitely.
There are. And our kids, teenagers right now are so overwhelmed.
Yes.
And they put it upon themselves a lot of the time, but there's so much academically and socially at stake that if you ask them to separate from it, that's really hard for them.
I see. Let's go ahead and Douglas, if we could do the risk factors and finish up there.
So motion sensitivity, so anyone with a history of car sickness or ocular motor dysfunction. So I always like to ask, do you have any uncles with a lazy eye or anything like that, like hidden in the family, because that suggests some ocular motor stuff. And then prior head injury, and I put there if untreated or mismanaged. So if you did a literature search, you may come up with the conclusion that if you get one head injury, you're more prone to keep getting them. And part of the tricky part with that research is this was before we really understood how to treat the injury. We really understood the pathophysiology of the injury. So we're assessing concussions now in such a comprehensive manner that we're not putting kids back to play until we're completely sure that they're recovered. And in doing so, we can reduce that recidivism rate or the amount of times they're going to keep getting injured.
Yeah, and you mentioned that comprehensive approach. Next up, we have the comprehensive assessment approach. And if you could, Douglas is going to put that up for us, and Dr. Reynolds will take us through that approach. But we've got the clinical interview as part of that.
So the center of my evaluation is always a detailed clinical interview. So really understanding someone's injury and what they've experienced with the injury, but also their, we call it the biopsychosocial history, their family medical history, all of these risk factors, things that have happened in their past that may contribute to recovery. Understanding their symptoms, both at the time of injury and when you see them in the office. The cognitive testing, so we do computer-based neurocognitive testing in most of these cases. It's about a 25-minute test that a lot of these kids are also taking at baseline, so pre-injury, which we can talk about. I do a vestibular ocular motor screen. So this takes less than 5 minutes where I can have them do some eye movements, do some fun things in the office, and get a good idea, is there a vestibular problem or an ocular problem that needs to be further assessed?
Yeah.
And then I put exercise on there. So this is really the forefront. This is really where we're going. And this is, this started up in Buffalo, the University of Buffalo. Pittsburgh is really big on this idea of exertion therapy, and this is what we're building here at the STAR. It's one thing to get the kids back in school. It's one thing to look at their vestibular system through just head movements, but it's another thing to get them up and moving. Okay. So a lot of these kids will say, I'm feeling great, I'm ready to go, and then they start running and they have symptoms. So incorporating that movement from an early stage is important, and it makes them feel better.
For sure.
I see.
But
Okay.
you start slow.
We start slow, and it has to be supervised. So that's the tricky part. I have a lot of kids that come in, they say, I tried to do this, it didn't work. And if we can do it in the clinic, if we can do it in the gym and see what's going on with them, we can give them an exercise plan that's going to actually supplement their recovery rather than get in the way.
Yeah. One of the things that you mentioned while we were going through the assessment, the comprehensive assessment approach, is you used the word baseline. And I've heard about baseline testing, and I know that there are some school districts that make that available, but it might be something that all of us as parents should think about doing for our kids if they're getting involved in sports or other physical activities. So what is baseline testing, and how would a parent go about having that done for their child?
So the baseline test is simply giving the neurocognitive test that we use preseason before injury. So the rule of thumb is to do it every year. until they're in high school, and then every other year from then on. And I usually recommend that you just do it in the summer. If you're getting your sports physicals, go ahead and do a baseline test. Now, sometimes you can do that with your pediatrician. You can do it in offices like mine, but a lot of times you can also do it through the school. So in Frisco, at least, all middle schools and high schools do it. Most of the surrounding communities do. It's pretty standard at this point that you're going to have that baseline test. Younger than middle school, you probably need a doctor's appointment, but we can baseline test as young as 5. The test is a little bit different for 5-year-olds versus 15-year-olds, but we can get that data. And so it's especially important for kids who might have any kind of learning problem to see how they performed before they got injured. So we're not trying to get back to, someplace they never were.
I see.
But once so we do the baseline, and then once they're injured, we do the test again, and then we can compare their scores to see where they fall.
Okay. Wow. So if it's not offered in your own district, you can ask, your athletic director, or you can ask your coaches about that. And if it's not available, then ask your own doctor. And if you can't get it done there, then we'll have a way to get hold of Dr. Reynolds, but follow up with that. Speaking of follow-up, let's go to following evaluation, which is the next slide here. Dr. Reynolds, if you'll take us through.
So it's really important when you go to have one of these evaluations that you leave understanding exactly what's going on. I'm a big proponent of the team approach. So I don't think that one person or one physician can do this in isolation. And it's important to have a number of professionals putting input into this treatment plan, but understanding the diagnosis, understanding the prognosis. So the first week, it might be a little challenging for me to give you a solid prognosis, but there are things I look for. There are patterns, there are risk factors in which I can give you a fairly confident idea of how long your recovery might be.
I see.
The treatment and rehab plan is very important, so making sure these kids have academic adjustments or accommodations as needed, things like extra time on tests, the ability to leave the classroom and go to the nurse if they're not feeling well, and then returning to class, some, a little bit less makeup work maybe if we can do that, exactly what they can do from a physical perspective for exercise, and then if we need to do any type of rehab. So there's different types of physical therapy you can do, there are medications, there are things that we might prescribe. And then just a very realistic return to play expectation.
And what would you say is the time frame for this? Is this weeks? Is it months?
The treatment plan? It's different for everyone.
Okay.
And sometimes kids will walk in my office. We used to grade concussions, and we stopped doing that. You probably remember the days of the graded concussions.
Absolutely, I do.
We stopped doing that because what we would see was someone would come in, on day 1, and we would say they fall into this category, and then day 5, they would look totally fine. And someone would come in and look like they were much less severe, and we'd still be seeing them 3-4 months later.
Wow.
So it's very dependent on the individual.
Got it.
So you literally have something new every day. Dr. Reynolds, every patient is something new and different. Let's go next to the concussion evaluation profile. And we talked a little bit about this already with the baseline testing, but there's more to it than that.
Right. So the ideal timeline is that you have your baseline test preseason, and then when an injury occurs, it's so important, this immediate removal from play. I try to tell athletes this all the time. There has been some recent research that if you stay in for just 3 minutes longer, you're 8 times more likely to have a recovery that's going to take 3 weeks or more. And if you stay in for 15 minutes, a new study said you're more likely to have a recovery of 45 days or more. Wow. So the kids that stay in and try to push through are going to take longer to recover.
Yeah.
Trying to get them in as soon as possible. So once they get into the middle school, high school age, they usually have access around here at least to an athletic trainer, not in every part of the country for sure. But the athletic trainer is sometimes that first line of defense. And then once we get them in clinic, we see them back on a weekly or every other week basis till they're better.
Yeah. When you talk about removing from play, that's such a tough thing. First of all, if you have suffered a concussion, then, it's hard to know right from what to do and everything, but
Absolutely.
then you just have that pressure of not wanting your teammates down, and do you speak a lot to that point of sometimes like the teammates or the coaches, we have to look out for each other on this?
Yeah, so we've come a long way in the past 5 years or so. But there's sometimes still this old school mentality. So I think it's really important that we start with the youth and just start ingraining them with this idea. It's not a sign of weakness if you need to come out. This is something we can treat, and you'll get better if you just say something. I don't know if you remember, I think 2 years ago at the parents clinic, one of the moms in the audience asked a question, something like, what if you see your child on the field and the coach doesn't bring them out and you're worried about it? Mm-hmm. And I remember it was one of the former players that was there and said, well, you take your kid out.
Absolutely.
As a parent, you have to be on the lookout for that. So I think as parents, even if they're not doing it at the league, the youth league level, talking to our kids, making sure they understand the importance of it and the safety issue.
Yeah, we do have to be our brother's keeper.
That's right.
In other words, on that.
That's right.
Let's go to the recovery timeline, and we've discussed this a little bit already because Nikki had a great question about it. But as you were saying, there's so many different factors with the recovery.
Yeah, so your risk factors are going to play a role. How bad the injury is, and sometimes that's hard to tell at first glance. But what is the mechanism of injury? How did it occur? Did you come out of play in time, or did you stay in? How soon did you get evaluated? And if you needed any treatment, how long was the delay of your treatment? And then this idea of rest versus normal activity. So we were talking about that, but the research is really pushing towards this idea of the faster we get them back to normal activity, the quicker their recovery times are going to be.
I see. And that goes to what you were saying earlier about exercise coming into play and the change in thought on that. So let's go to the part about our exercise effects on the brain.
So this is really just about general benefits of exercise. Exercise is obviously so important, but all of the things on this slide are things that can be affected when you have a concussion. So that blood flow to the brain, that decrease in blood flow to the brain, if you move your body, that's the best way to improve blood flow. So that helps with the energy problem. The autonomic nervous system is that fight or flight response. We want to make sure that that's regulated and you're not stuck in that anxious fight or flight feeling all the time. BDNF is often called miracle grow for the brain. They are awesome brain drive neurotropic factors that we all have, and when we exercise, they help repair neurons and repair connections, which we need during concussion recovery. And then, it improves mood, it improves sleep. And again, these are things we should all be, exercising for these benefits, but during concussion, it's so beneficial. And I should say, when we talk about rest versus normal activity, I say obviously, but I do have to state, the first 24 to 48 hours, we're very careful with this. We're monitoring them. Sure. If they need to nap, I'm never going to deny someone from sleeping during that time period. But it's really after that mark, okay, let's get up, let's get moving, let's see, what we can do.
Because too much sleep, like you said,
too much
could be
sleep,
a problem.
and that contributes to then they can't sleep at night. And
Yeah, and that leads us into behavioral regulation.
Yes. Okay, so my first line of defense for treatment seems very basic, but a lot of teenagers and kids don't hit all these marks. I mean, a lot of adults don't either. I think I can say.
Nikki and I don't. We're going to try and do better, Dr. Reynolds, we promise.
So having that regulated sleep, some kids are just nappers. They take a nap after school. I don't want to dysregulate that too much, but I try to keep them to 30 minutes or less. The recovery from concussion really happens at night when you're cycling through those deep sleep cycles, so we want to preserve that. Making sure they're eating adequate calories. Wrestlers are very hard to treat with concussion, especially if they're used to cutting weight for meets.
Oh, yeah, because they have to cut back to make weight before their match.
And it's a mentality, so they get into that. Sure. So making sure they're eating, making sure they're drinking enough water. Our kids are chronically dehydrated.
Yes.
And so I always advise them to drink at least half their body weight in fluid ounces of water or more if they can. That 30 minutes of physical activity, and if they're symptomatic, I just want them on a stationary bike or walking, doing something to move. And then stress reduction. So
that may be the hardest thing, because you spoke to that before about how, a lot of it may be self-imposed by the teenagers, but there's also from parents, teachers, coaches.
Well, and what I find, a lot of teenagers aren't aware that they're doing this, but they use exercise as their release. So they have all of these hard classes, they have social demands, some of them have jobs, and they're playing sports. And when they play sports, they're feeling great. And so when they have a concussion and they're not able to do their work as well, and they're struggling in school, and then they can't be with their team, and they can't play with their sports, they've lost that stress outlet. Yeah.
And it probably also kind of feels like a punishment too,
Exactly.
you know,
Absolutely.
which
Right.
makes it tough there as well.
Not able to do something that they love.
Yeah, well, if we've, done our behavioral regulation, we've done all this stuff, then let's talk about the criteria for return to play, because, we
what
know the
everyone
kids want to get
wants.
back out there.
That's right. So as a neuropsychologist, I'm more concerned with return to learn, but they all want to return to play.
Sure.
So the criteria is they have to be symptom-free at rest. So that means they need to get through the whole day of school without a headache or any symptoms.
So that is reasonable to expect them a whole full day of school.
Absolutely.
Okay.
Absolutely. And once that happens, we do a 5-stage return to play protocol. So if you're in an upper level middle school or high school, your athletic trainers are all educated on this. For the younger kids, we can provide the protocol, but it's essentially day 1 is just walking or biking. Day 2 is a little bit more intense. Day 3 is a little bit more intense. So we're progressing them up to contact again, essentially. Okay. And you have to be able to get through that with no symptoms.
Wow.
So we want full cognitive and physical exertion, and then that neurocognitive testing plays a role. So if you have a baseline, we want your scores back to baseline. If you don't, we want them to be what we would expect them to be.
Very good.
Boy, we've covered a lot of territory
Yeah, we
here.
have.
There is a lot of information, and that's why it's great. You can go back and replay if there are some things that you want more information about.
Absolutely.
But let's talk about some of the takeaways that we want from today.
So I think the most important thing for everyone to understand is that concussion is a treatable injury. There is so much. There's so much in the media right now that parents get really scared. I have a lot of parents that come in and there's been one injury and they want to pull their kid from sports. And I emphasize that we didn't treat it like this 5-10 years ago, and we're really good at it now. So it's a treatable injury. It's nothing to be afraid of, although you have to take it seriously.
Right.
Active recovery is the key here. No more dark rooms, no more sleeping all day. And sport is so important. I get the question every day, should I let my kid play not just football, hockey,
Right.
soccer, all of these? And there's so many benefits. I mean, I've heard it at events with you so many times, with the team building, the leadership, the resilience. Those things are so important. And so to take that away, and we see a lot of concussions, just like your son, playground injuries,
Sure.
Car accidents. It happens every day.
That's right.
we can't be like that old 1970s, after school movie, The Boy in the Bubble, where we wish we could
right.
take our kids and our grandkids and, put them in a
right.
bubble and plastic
Yeah.
wrap them and keep them safe forever. But that's not possible.
No.
But it's great to know that programs like yours are available. So, Dr. Reynolds, let's talk, because the people who are watching this are not just in the Dallas-Fort Worth area or may not have access to the Baylor Scott and White at the Star in Frisco, but let's say I'm a concerned parent or grandparent. What do I need to do? Let's go back to baseline testing, or just if I have any questions whatsoever, what should I do?
So the worst thing you can do is Google.
Okay.
The worst.
Okay.
But finding in your community, is there a program for baseline testing? Are there athletic trainers that go out to youth sporting events? Talk to your pediatrician or your primary care doctor about what they offer in the office. In most major cities, there are clinics, but in the rural parts of the country, there aren't so much. So finding who it is in your community that can help you before you're looking for someone is really important.
Yeah. Wow.
What a wealth of information.
Yes.
Goodness gracious.
This is going to be our highest rated show ever.
Wow.
So thank you. Also, Douglas Barricklow, who's been producing and technically directing and helped get all of this with your presentation together, also to Kent Garrison and Dr. Reynolds. We can't thank you enough.
Yes.
Thank you for
It's
having
been
me.
great.
Thank you.
We look forward to the next Parents Clinic that we do together. And as a mom,
Yes.
Nikki, I'm sure that you have some.
I've got more questions.
Well, no, go ahead. You got another?
Because I just feel like when my son was concussed, I didn't get any of that, what you just gave me. And I feel like we were at a disservice, and I'm like thinking, okay, well, what damage has happened in the time period since that had happened?
Right. So the good news is your son was young, right?
Yes, he was 7. I'm sorry, 7.
So kids are resilient. We talked about that, especially the younger kids. I always tell people, if there's been a remote concussion, an older concussion, and it wasn't maybe treated or evaluated fully, is there any residual? So some kids, every time I do one of those parent clinics, someone comes up to me and says, my son or daughter had a concussion years ago, they're still having headaches, or they're still this or this. I think those kids should still be evaluated. So I've evaluated concussions from 2 or 3 years ago, and sometimes we can pick up on an ocular issue or a vestibular issue, and we can still fix that problem. If there's no residual issues, though, I wouldn't worry about it. Okay. Especially these one-off concussions. You know, if it happened again, you would get the evaluation, and it would be fine.
Got it.
Yeah.
Got it. Thank you.
All right. Well, thank you. Thanks again. That's Dr. Erin Reynolds, clinical sports neuropsychologist at Baylor Scott and White Sports Concussion Program at the Star. Again, we thank you so much, and we thank all of you for tuning in to the most important show that we've ever had here at 5 Points Blue. Thanks a lot.
This has been a production of 5 Points Blue, DallasCowboys.com, and the Dallas Cowboys Football Club.